Hello, everybody. Welcome to tonight's webinar. You get three of us tonight, which is nice. We're going to introduce ourselves first. My name is Tom Pevny. I'm an orthopedic surgeon with ValleyOrtho.
I'm Adam Kliebert. I'm a physical therapist here at Valley View, working out of the Glenwood Clinic.
My name is Dylan Frazier. I'm an athletic trainer working with Dr. Pevny up in the Valley team. I wanted to welcome you all to the Valley View University. First off, I want to thank everyone for being here for this webinar. I have a first thing, I got a few housekeeping items to address. You guys can submit your questions through the Q&A chat at the bottom of your screen. At the end of the video today, we're going to go ahead and try to answer all of the questions to the best of our ability. And we're unable to answer questions regarding personal health information. So the less you can include about yourself specifically, the better, and the better we can help answer those questions for you guys. So we're going to go ahead and jump into it today with a PowerPoint about knee injury prevention.
All right, so we'll get started. So I don't think you can see me, so that's probably good. Well, we're going to start with the knee and me, so winter activity support. We're going to dive right in. Dylan's going to be my very willing participant here, and he's going to help me out. So when we're thinking about winter activities, hopefully we're just halfway through the season, and we have a long winter to go because I'm not done with it yet. It's good to have like a self check-in. How am I doing? How's my body doing? Is my knee healthy? Is it going to finish the season, or am I building myself up, or throughout activity am I slowly tearing myself down? So I wanted to kind of go over some self-assessment tools so you can assess, okay, how is my knee being supported throughout this winter season? So we're going to go over a couple things. There will be, there's a picture there of a health guide, a knee health guide. That will be provided to you through your registration email. And then in the near future, it should be up on the website as well for access long term. So this first page, we're going to go through a couple slides too. We're going to say, do I move well enough to support knee health? So we have a mobility checklist. And then we got to look at how your squat is looking, or you have to look at how your squat is looking, because that squat is the foundation for everything that we're doing, whether it's uphill, downhill, classic, skate ski, all the things that we like to do, snowshoe. We just need to make sure that squat is healthy. So we're going to make sure you know if it's healthy first. Okay. So we'll kind of go on through here. First, knee. This is probably the more simple one that we're going to get to. The knee should go to a straight position and not hurt. And the knee should be going to about 135 degrees and not hurt. So you can see on this scale, like it says 115 degrees is needed or around there for biking. If you can go around on a bike pretty normally, we can assume you're around 115, 120. If you can touch your heel to the butt, we're not worried about you. That's fine. If things start to hurt though, we always want to be wary of that. But if you're anywhere in that range or look close to that picture, we're going to demonstrate here with Dylan. Real quick, we're going to bounce in and out of this, make a lot of noise. So, Dylan, why don't you lay on your back here? So here we go. This is all you need right there. Okay, if this is comfortable, this is a position to hang out in, we're not really too worried about you. This is great. I don't know if you hear that crack, but he's doing awesome. All right, so then if we go straight, we want to say, does this go into a full straight knee position? And you can look in the mirror, you can take a picture. Straight enough is straight enough, as long as it doesn't hurt. If it hangs in a hyperextension, that's completely normal, especially if it's non-painful. Okay, so that's the knee. That's the end of our presentation. Thank you. We'll go back to the slides. As we kind of move along here, there is, let's see. No, sorry. So if that was all we were talking about, we'd be done. But when we're looking at a whole movement pattern, we have to appreciate what's happening on either side of that knee joint. The knee moves primarily in two ways. is a stability function joint. So where we get all the support from, we have to have really well-moving and healthy hips, and we have to have good enough ankle mobility so that the knees don't take a twist or take impact too soon. So that's why we got to expand from just looking at the trees of the knee to the whole forest of the whole leg. Okay, we're going to move through this. So we're going to start below. Now, I have put two phone apps that I think are really helpful on the side there. There's the Measure app for the iPhone, and then there's a Level app on the Android. Both of these are free tools. I think the iPhone comes on it. So we're going to demonstrate ways to measure joint angles with the iPhone alone. Do you have an Android?
I have an iPhone.
Okay. Well, we're going to do iPhone demonstrations today. But it would work all the same. So there's three different ways to kind of check in on ankle health. We can see how well the knee moves past the other leg in a heel to toe position, as demonstrated in number 3 there. The number 2 option, we can stand about 4 inches away from a wall from the toe, keeping the heel down. Can we touch the knee to the wall? If you can, we're in a good enough shape and we can move on. Or we can look at just putting that iPhone app on the front of the shin, keeping the heel down and driving that knee forward over the toes, and we get to 40 degrees. All these are really easy ways to do this at home. You don't have to hit all of them. Just pick one that works for you. We're going to demonstrate a little bit here on Dylan. Okay, we're going to go with option 3 first. So heel to toe position, which you can see here. What we're looking for, we're testing the back leg. Okay. We want to see, can this knee pass this part of the ankle bone?
No,
Well,
well,
there's a learning curve to this one. We're going to stand up a little taller here. We're going to give him some balance support. You can use the wall in front of you. Okay, so keeping this knee, and we keep it straight direction. Drive that, just drive that knee, that right knee forward.
Oh, gotcha.
Don't move that knee yet. Well, don't move it backwards. Right there is good. So he's borderline. We're going to call it borderline. We're going to ask Dylan to do better. Okay. So what we're going to do, we're going to go into the Measure app, and then we're going to hit the Level function. So then it's going to look a little bit like this. Okay, so it'll give me an angle as I go. So Dylan, go ahead and step forward with this foot a little bit. Keep your heel down and go ahead and drive that forward. Perfect. So you can't see I'm looking at the angle finder. We're at 42 degrees. So he crosses the finish line, arms outstretched. So he makes it to 42 degrees. Okay. And we test both sides and look at that. Again, there's another option. If I don't really have a good wall here, I'm gonna do the wall. All right. 4 inches is about here. Put your toe right there. Okay. So if my leg is the wall, his knee's got to touch my leg. I don't feel it. It's kind of there. There it is. So again, barely limping through the finish line. He has it though.
Really
Good job. All right. So then we'll go back to the slides. So that's your ankle clearance, and that dorsiflexion motion is super important for. It's one of they have some studies that show for long-term health and balance, and it's one of the most important motions for us because it's the first thing hitting the ground. So having this amount of motion, if you don't have it, if not for winter sports, we want it for just health in general. Okay. We'll head down to the next one. So then we're gonna move up the chain. Okay, so we're gonna test above the knee. So on these ones, I would say use the Measure app or a Level app on your phone. A partner can place it as well. I'll do that with Dylan. Or you can film yourself or just look in the mirror and kind of eyeball about these measurements would be appropriate. Okay, so we'll test a couple here. So in standing, okay, I might face that way. So we're gonna stand really tall. Okay, I'm gonna have you come to about 90 degrees with this leg. Okay, so here we go. That's about 90 now. Can you come up a little higher? And keep going, keep going, keep going, keep going. Perfect. So I'm gonna get to about 30 and he's about there. Okay, so that's, check my math, 90, 30, 120, right? Okay, so 120, that's about what we need. We can also do this laying down on his back too. if we want to do that, but another option. Let's have you sit. Okay. Again, I think the level app is one of the easier ones. So we're gonna do rotations. We're gonna check his right leg. All right, so I'm gonna be bringing this leg up and in. Okay, so despite the foot moving up and in, he is at 46 degrees there. This is external rotation because we're looking at what the hip's doing. Okay, so I don't think I labeled it wrong on the sheet. I may have, but this is external rotation here. And then we'll have you go the other way. Okay, this is internal rotation at the hip. Level you out, come back down, sorry. Okay, let's go again. Okay, so he's at 33 degrees. So, and that's fine. Dylan moves well enough. Nobody's mad at Dylan. Dylan shouldn't be mad at Dylan. Dylan's moving okay. All right. So, hip extension. Let's go laying on your stomach. So again, level app or a mirror. We're looking, can he lift his whole leg up off the ground? Perfect. 23 degrees. Dylan is exceptional in this motion. Okay. So Dylan has more than the 10 degrees that we would want for like a normal stride, say for skate skiing or cross country classic, hiking, running, skinning, right? He can do that, right? So let's keep moving forward because I know we want to get to your sport specific questions. So yep, we go and then the next one as well. So we hit those, we know how to measure them. It's in a guide for reference later. I know I'm going a little quick, but I want to give you time for questions as you need. So now we're going to check out, okay, Dylan moves well enough. All right, check that box. Now we have to see, his joints move well enough. Can he control his joints well enough to keep his knee healthy? Okay, so in these two pictures, first we're going to look at general standing. Okay, so to set up a squat for monitoring, we want to see, okay, are my feet shoulder width apart? Okay, we're going to start there, and the toes are mostly forward. That is a test of that dorsiflexion. If we go way out to the side with our toes, which it's fine to train and squat like that sometimes, but it doesn't really let you assess your knee health quite as well. So toes mostly forward. What we're going to look for during the squat, as you can see in the green good version, those knees are still lined up over the toes. In the no good version, those knees are collapsed in a little bit. Okay. We're also going to look to see, is his trunk centered between his legs? Sometimes we avoid loading a leg and we don't even know why. Maybe it's painful. Maybe we just never load that. But if you drift to the left or the right, there might be a reason for that. And that would be something to be aware of. So we're going to go continue to beat up Dylan and test him out. So Dylan's turn to squat. So toes. Mostly forward. Let's face straight ahead, kind of like the picture.
Yeah.
Toes are forward. Let's narrow the feet just a little bit. Shoulder width. Perfect. Okay. This doesn't have to be a deep squat. We're talking maybe 90 degrees of knee bend. And we're just going to see how Dylan moves. Good. And back up. I'm going to watch him from here because I have a bad clinic habit. I just have to watch. I can't let Dylan leave here without knowing how he's moving. Pretty good, pretty centered. Any pain with that, Dylan?
Yes, sir.
Great. Pass, cleared. All right, let's go to the next slide. We're going to go look at, so double leg. Cool, he can do that. We can probably ski. We can jump. We can do things like that. So now we're going to go and look at his single leg squat. This is where things can go south quickly, but not Dylan. So let's look at, in a standing checklist, okay, there is that green highlighted box. The things that we look at and focus on are, are the shoulders level, and are they mirroring the pelvis being level? And then when we draw a line down the trunk, like in the sternum, is that a vertical line? If we have all those things, we're going to be pretty happy with the setup and standing, okay? If we look at the pictures next to them, we have a slight change, especially with our skeleton friend. That pelvis is shifted over the stance leg. The trunk is very much over it, and the shoulders aren't level. What this is, and this is very common, this is just a way to stack the body over one leg. When we look at standing on one leg, it is a balancing scale, okay? You have to have equal weight on either side of the scale or you will fall over. There's just no other way to do it. There's a couple different ways that people pick to do that. It's either the green box there, where we shift our pelvis over the standing leg and everything stays level in the spine, Or we tip our trunk over that standing leg and then things start to rattle a little bit. Okay, so we want green boxes. So Dylan, let's see what we got. So we'll stand on that leg. Okay, cool. Again, I don't want to get in front of the camera, but I want to be right here. How are we feeling? I want to see Dylan's pelvis to come a little bit further over. And what you see is that drops his shoulders down just a bit and levels his pelvis. Now we have a nice downward angle of the femur, and this is how I would stack and support that leg. It might feel a little awkward for you guys. I probably do this, if I have a leg pain patient in the clinic, this is something that we're working on, whether they're relearning how to stand on a leg that had surgery, or it's my ankle hurts, my knee hurts. We just learn to stand a little bit different, okay? So pushing that pelvis out to the side, there he goes. And we look at, when you have buttons, wear something with buttons, that's really good. Because this is gonna change right here. He's got a zipper. I want that zipper to be vertical to the ground. So I want Dylan to do a little bit more. There it is. Is that weird? Oh, cool. So this is Dylan's green box, okay? And when we find this is where we want to train too, okay? When we're training single leg squat, when we're training a bunch of the exercises we're going through, we're gonna make Dylan go into the green box before we do anything, okay? Perfect. So let's go into the next slide. We're gonna talk about, that's the setup for the stand. Now we're gonna go through the motion of it. Okay. So this guy, now we have a green box. This squatting. So on the single leg, we want to have the knee tracking out over the toe. We want to maintain that level pelvis, level shoulder, vertical trunk. Okay. The red boxes, we get a whole host of other things that we could be doing. Dropping the pelvis, shifting too far over. Now, this guy's doing all these things so he doesn't fall over. It's just not a very mechanically advantageous way to do it. Okay. So if we're going to train, and if anybody's tried to get stronger, they're probably doing a squat of some kind. I want it to be in the green box. If you're squatting, you're wasting your time a little bit if you look like anything in the red box. So that's the tweak I want to give to everybody. If I could get that, I might be a lot less busy, and that'd be okay. Everybody else will be a lot healthier. Okay, so now, Dylan time. Test. Let's go back. Single leg. So first, make sure we hit that green box standing, right? Perfect. Vertical. Awesome. Feeling good. Let's go into a little bit of a squat there. Good. And up. Okay. How we feel?
Feel pretty good.
Okay, you can do a little bit of
strong, but it's a wavy.
a little bit of weight. Again, we're messing with that green box a little bit. So let's go one more time. Nice. Knees track over the toes. Very good. I'm just mean like that, but his trunk goes a little bit over that leg. It's hard. And that same thing we saw in standing, that pelvis needs to shift that way and stay shifted that way. That will allow his upper body to stay on this half. Try it, see what we think. What do you think about that?
Yeah, I can definitely feel my trunk being
Right?
over a little bit.
It's nice,
Yeah,
right?
yeah, sure.
So again, this is mirror work. This is pointing out for you. This is not, your body didn't come with a manual. We're trying to like,
Mine did.
no. Perfect.
Yeah,
Cool.
that's better.
Right, so just a little bit difference in how we're loading that leg. That is a more knee healthy, supported way to do that. Okay, so that's what we're looking at for most of our work. Okay, let's go back into the slides. So what we've done so far, am I doing 20 minutes? Not bad. Let's go to the next one. Okay, so here's a couple checkpoints for you. So we did the assessment. We looked at how you stood. We looked at how you move. We looked at your joints. We looked at your squats, okay? Here's a couple breakdowns on what we need to be doing. If you're not hitting some of those marks with the mobility tests, we've provided a mobility, what do I call it? Mobility restoration guide. So that would be something we can reference. We're gonna run through a couple quick stretches here, but they're all broken down in the handout for you to come back to later, okay? We're gonna start with the knee flexion one. So let's go down. Cool. Let's have you up on your hands and knees. This is good for hip and knee. If the knee's not moving well on one side, we're going to put a little towel underneath the shin. Okay. That's just going to help some normal mechanics get in there. And then he's just going to push himself back, not to pain. We're not going to stretch into a lot of pain or joint stuff. Okay. He's showing off because this is one of the ones he does really well. Okay? So it's looking good. but that's going to give good knee flexion. It also is a nice hip flexor too. If he's pushing his butt back, we got a good hip flexion space to stretch there as well. You don't need the towel if it's just the hip limitation. Okay, so we'll take that off, and then let's go through. So that one, the knee extension is really just keep it straight, push it down a little bit. And that one's pretty self-explanatory. So we'll go 2 slides down. Okay, so now we're going to talk about if my ankle can't move very well, we're going to look at 2 ways to stretch the calf. We're going to look at some hip external rotation stretching and hip extension stretching. So we're going to kind of cruise through those. We're gonna pick on Dylan again.
Perfect.
Okay, so Dylan, let's do ankle dorsiflexion. Let's do some gastroc and soleus stretching.
All right.
Okay,
Standing, is that right?
standing, yeah. So you can do it up against a countertop or a wall.
Like a wall.
Perfect. Wall's good. Ankle, the heel stays down in the back. On this one, we're going to keep the knee straight. That's going to stretch one of the longer muscles that crosses the knee. The other way that we can get at that ankle joint is he's just going to bend that knee a little bit and drive that knee out over the toes. Okay? That's going to get a different joint, a little bit different muscle, a little bit lower in the calf. Both are really important. Okay? And we go through holds and breakdowns in that guide as well, but we want to hold it for a little bit more time than we're showing today. But and then let's go to hip external rotation. So sitting, we're going to throw one leg over the other.
For my right hip.
Yeah. Okay. And then we're going to pull that up and over to your shoulder there. So we're going to get a little stretch up into kind of the glute a little bit. Okay. And I would try to have, and that's one way. If you feel a stretch and you like it, there's nothing wrong with that. What I'm going to have him do is pull up on the shin as well, and the calf and bringing both of those up and over. You can also do this. This is being shown laying down, but I don't know if you're going to be able to see what Dylan's doing if he lays down. But laying down is a little bit easier for that one. Okay. And then we'll go hip extension. So let's go kneeling on the table. Let's go the other leg. Perfect. So in this one, he's going to try to keep his trunk pretty vertical here, and he's just shifting weight forward so we can drive this leg behind. Again, Dylan's a rock star in this motion. This moves plenty. You have a good stretch in the front of the leg there?
Yeah, feeling good.
Perfect. Okay. Just go to a comfortable stretch. And then internal rotation, we'll just go right into that. It's on your stomach. Sometimes the towel in between the knees is helpful, and you just kind of pin that. Knees up to 90. We're going to let both legs kind of fall out to the side. Okay. We'll get to that picture, and hopefully that's just a gentle joint stretch for you there. We'll go into the slides again. When we're talking about mobility work, we'll click down a couple. If you have pain with motion, it's more of a little bit of a red light. Okay, and it's okay to work on mobility for a little bit, but if you consistently run into joint pain or muscle pain, you can't figure it out. That's what we're good at. Like, we're here, Dr. Pevny's here, rehab team's here. Let's go talk to somebody. Okay, we can get you through it. We don't want you to run your head against the wall for more than a week trying to do these things. Okay. All right. So moving through. So hopefully you can improve your own mobility. Now we're moving to squats. Dylan moves really well everywhere, so he's ready to squat. So if you have good joint mobility, but your squat form is maybe you can't hit those green boxes. This is where we're going to bring in a little bit of an assistance tool. Okay. Here, let's go into the, yep, perfect. We're going to hold on here. That's more my height than your height.
That's all right.
Okay, so we're going to stand on the left leg. Okay, so we always want to be opposite of support. It's just going to give us a little bit more stability when we're using a wall or a cane. So let's go into a single leg squat, and we want to support those green boxes. So we want to push that pelvis out over this way. Trunk comes towards me. There it is, and then up. Okay, and then down. 25 of those, Dylan. All right, so no. So that's, but we want high repetitions in this. Once you get into the green box, how many reps can you do in the green box? Especially if it's new for you. If you are learning how to behave this way, repetition is very important. So I want that to be noted. Okay, so we do that on both sides. Not for Dylan, for you, if you need it. And then we'll go into the slides again. We're going to talk about, okay, so now we squat well, we move well. We are in a complete pain with squat. same as like mobility work. If you can't correct your form and that doesn't help your pain, right? We don't want to put a square peg in a round hole for too long, right? Don't keep doing it. Give it a week, try to work on your form. If it's not improving, please come talk to us and we can help you in the right direction. Okay, so now we don't have pain. We move well, we squat well. Just keep doing well things, right? Like move a lot. So we have a little bit of a guide here that's going to talk about how to do a couple exercises that we're going to breeze through. The first one is going to be a stability exercise. So we're gonna click one slide. Yep, that's fine. We'll do this together. We have a floor washer, which Dylan is amazing at. Okay, so here we go. We're gonna get into our green box single leg stance on the left leg. Okay, mild knee bend, mild. Now what he's gonna do, he's gonna put his foot on the towel. If you have socks on the wood floor, that's fine. So it's gonna touch the ground. Start slow, and this is go side to side. Keep that knee exactly where it is. Get that trunk over. Right? That's where I want you. Now, how fast can you go and nothing else moves? Come on.
Not that fast.
Come on. All right.
Let's see about
And then we'll do,
swinging.
we can do that in all the directions that are pictured in that exercise, right? But the goal is how fast can you move, but don't let that knee move. Don't get out of that green box position. Okay. All right. And then the next one. You want shoes on? There's some jumping.
Sure.
Let's not jump too high.
No, I'm good.
Oh,
There's
all right.
we're fine.
What we're doing here, some of the quarter turn jumping, right? So I'm gonna have you face that way first. I want you to jump, let's face this way. So we're gonna do quarter turns, 90-degree turns. So he's gonna jump and turn and face the camera. Let me see how well he sticks to landing. Can he keep that knee in that green box?
Have a double leg or single leg?
Let's do double leg.
All right.
Double leg. Dylan wants to warm up. All right, let's go double leg.
All right.
Yeah, little, very tiny, very tiny.
All right.
Yes.
1, 2, 3.
Perfect. Good landing, knees out of the toes. Love it. Head back. Let's do a single leg version. Pick your leg.
Single leg.
Nice. Faster going. Very good. Okay, so those are the quarter turns. We're not going to have Dylan do the max verticals, but that's also a good one to do to work. If your form is good, if you know you can squat well, can you put some power behind it and maintain it? Videotape yourself, do it in front of a mirror, have something monitor you. Can I keep a green box form through a lot of power? Super important. One more I'm forgetting. Thank you. Skaters are on there too. So like that's a lateral bounding type motion. Don't fall down.
Yeah.
All right, little, tiny. He's gonna go tiny because we can't have an injury here. Okay, so we're gonna work on single leg landing. Again, we land with the knee going out over the toes. Perfect, Dylan. And we want to be kind of supporting that green box positioning. Okay. So that's our kind of restoration guide, how you can keep yourself healthy through winter sports. And now I'd love to kind of get into questions with our awesome panel here with Rachel and Dr. Pevny, and we'd like to talk sports specific.
I'd like to start by saying that's pretty impressive.
Thanks,
Absolutely.
Yeah.
I think you're gonna be injury free for the rest of the winter there. You're pretty good at those things.
I did practice. I
Give
didn't
him a hard
want
ride.
to put you guys to shame.
All right.
Oh, you did great.
First question. If physical therapy did not work for my knee pain issues, what are other non-surgical steps?
You want me to tell
If you hit it first, I might.
Okay.
say something, yeah.
Yeah, you know, if you've tried therapy and it didn't help, to me, that would make me think that there's something structural going on in the knee. Because most soft tissue injuries around the knee will respond to physical therapy. So at that point, you need a really good physical examination, probably some imaging, starting with x-rays and possibly, if we were worried about soft tissue, getting an MRI. So I think maybe getting a clear diagnosis first. And then, you know, if it is something like a cartilage tear or meniscus, those things generally do not respond well to therapy, and that might be a surgical thing. If you have early arthritis, which is wear and tear of the joint, then there are a lot of non-operative things we can do, such as injections, medications, cold therapy, things like that that could be helpful.
Yeah, I'll piggyback on that. I have the benefit in my practice. I get referrals from these guys who have already said the knee's good enough, right, structurally. So when we see them, then I'm looking at the forest. I got to look at the hip. I got to look at the ankle, right? So I would check those things on yourself. But if you've already been there, the structural piece, if you hadn't had a good orthopedic guy look at your knee, I would come to our crew and get that checked out.
Yeah, and that's a great point because knee pain, you can get referred pain to the knee from the back and in particular the hip. So you always have to rule out things that can be causing the pain if you don't respond to the appropriate treatment.
How long does a knee replacement last in a very active person?
I guess that one's for me. That's kind of a loaded question. It's a good question. We really don't have the exact answer to that, and there's a couple reasons for that. One is because the technology changes, so quickly. Like, for example, I've been doing total knees in this valley now for almost 30 years. And so our technique, the materials that we put in the knee, the technology as far as getting the cuts right and putting the components where they really need to belong has changed so much. And I can tell you that a lot of my patients, most of my patients are very active. Most of my patients are skiers. And I can tell you, most of them that even we did like 30 years ago still have their same knee. So, it's hard if you're young, like in your 40s, early 50s, that's still kind of young for a total knee. And if you're going, just like any material, if you stress it repetitively over time, it can loosen and things can happen. So I think you could still be active if you're young with a total knee, but I tell my patients I don't recommend repetitive impact loading, like I wouldn't run for exercise. I think you're going to get more longevity out of that component if you're more into swimming, biking. But having said that, people can still run in sports where it's more like spurts like tennis or pickleball. Patients can ski. We've shown that the skiing really does not lessen the longevity of a knee replacement. So I would say if you're in your 60s and above and you get a total knee, it should last you the rest of your life. If you're younger than that and you live long enough and you stay healthy enough and you're active enough, then you may need a revision for loosening at that point. But I like to do total knees in patients that I think it's going to last them their whole life, and most of them do, even in active knee.
Are there workout classes you recommend for knee strengthening? Such as CrossFit, yoga, Pilates?
I would try to, how do I say this? If your goal is to be better at yoga, you should do yoga. If your goal is to be better at Pilates, do Pilates. If you want to do exercise to get back to skiing or some type of impact activity, we should have an exercise routine that more mirrors that, like an aerobics class or some jumping CrossFit loading type stuff. So I would try to make it specific to what you're trying to accomplish, and you're not going to go too wrong that way.
I can tell you this though, I and this is from patient experience and my personal experience, that as we all get a little bit older, I think doing those like yoga and Pilates, I think are important no matter what you do, because as we get older, to me, the two main things are that you want to try to maintain, also to help prevent injury, like they were talking about, is flexibility. We all get stiffer, and core strengthening. And you get a lot of that in Pilates and yoga. I personally have not done Pilates, but I can tell you that my patients that have done Pilates all say that it's changed their life. So I get a lot of really positive feedback. I have done yoga and I go through spurts, but I can tell you personally, it's really good for me. But I do have some joints that the positions you get in sometimes in yoga can exacerbate some joint pain if you have that. So just be careful and modify the positions you do if you do yoga.
What is the best training for skiing?
Skiing. No, I mean, yeah, but it's there's a lot of like preseason conditioning classes that people give, and it's important. It's like if you haven't skied in 6 months, then you really want to work on again what they were doing here, which is balance, strength, and what we call proprioception, which is kind of the combination of all of those. So really getting your core strong, getting your hamstrings, your quads, your hips, musculature strong, I think is really important before you go out there. And know your limitations. I mean, if you're skiing and you kind of feel fatigued and you're like, hey, I'm going to do that one run I love once again. If you think about it, don't do it. Because when you fatigue and you're tired, then you're kind of setting yourself up for bad things to happen.
I would add when you are doing that preparatory, that preseason training or transitioning work, those green boxes of movement are really important. If you're on single leg, really try to dial that in to get the value of the protection. There's a lot of bad ways to do a squat, and that's that. If you can work away from that, I want to say that will help you in that season if you can focus on moving a certain way, not just, well, I did 10 squats. Well, how were those 10 squats would be my next question. I want those to be like, do it well, get the most out of it. You're putting in the time. I would challenge you to look really good when you do it.
How long is recovery for knee replacement surgery?
Everybody's a little bit different. I can tell you that. Generally, I tell people 6 months where you're kind of back doing everything and you're not thinking about your knee. These days, which has changed also, not only our techniques, but most of our total knees now are done as outpatient. So people go home the same day. It's about an hour and a half procedure from the time we cut skin to where the dressing is on. The components are solid once you leave the OR. So we're pretty aggressive as far as letting people bear weight on it right away and letting people move their knee. We don't brace people. We get them into therapy right away. It's important to get your full extension, straightening. The bend generally comes a little bit later, but it will come. I've had people, we had a patient last year or a couple years ago sent us a video of them skiing on Aspen Mountain 2 months after a total knee. And actually, I'm not saying names because I can't, but a patient that I did a knee replacement on today, when we did his other side less than 2 months ago, he sent us a video of him hitting tennis balls 3 weeks, which I don't really recommend, but and he wasn't running around too much. He was hitting ground strokes, but I think I could have beat him. But so everybody's different, but we get you up right away, and some people feel great at 3 months. Sometimes it takes 6 months and people even improve up to a year.
What muscles do I need to strengthen to protect my knees while skiing?
Hip control is really important. Making sure that hip can hold you in that position is important. So we have glutes and external rotators. Quad and hamstring strength is really important. And then when we're getting that training in single leg, getting quad and hamstring work, we want to have in good form so that the ratios are right. So hip control, knee control with the quads and hamstrings.
Are there any winter sports I should avoid if I have weak knees?
Not really. I mean, I'm not sure what if you have weak knees, do the exercises that Dylan showed so well here, and you'll have strong knees and you can do those exercises. To me, it's a pain issue. I mean, if there's winter activities that people really love to do and they have a little bit of discomfort, you're probably not doing any significant damage. And maybe ice it afterwards, take some over-the-counter anti-inflammatories, and probably all you need to do is see Adam and get into a good physical therapy program, and you'll do great.
Is Dr. Pevny accepting new patients?
Yes.
Yes.
Absolutely.
Absolutely.
We see new, old, we see long. Where? I see patients in the Upper Valley. I have an office in Aspen, right on Main Street. Beautiful little Victorian. Rachel and I see patients there. And she also sees patients independently as well if I'm at another clinic. The other clinic I see patients is in Willits, right across the parking lot from Whole Foods. I think that's it.
Yeah. That is all the questions we have. All right. You have the sheet of paper I gave you.
Yes, I do.
Will you hit those last announcements?
Yeah, absolutely. All right, so I've got some finishing announcements here for us. It's number one, we want to thank everyone for coming and joining us on this presentation. We would love to hear your feedback. If you have the time to fill out a quick survey, it'll appear right after this webinar closes. We'd really appreciate if you take the time to do that. It helps us do these better and be better at what we do in the office. You're going to receive an email with a recording of this webinar set to hit your email in about 24 hours. That'll include links to the handouts and the sheets that Adam and I discussed today. The next webinar in the Women's Health Series is tomorrow, February 6th at 12 p.m. noon with nurse practitioner Katrina Metcalf, who will be discussing heart health for women. Sorry. Thank you all again for joining. We really appreciate you guys and have a good evening.
Thank you.
Thank you.